Partial dentures are often a cause of problem over time. When a partial denture only replaces 1 or 2 teeth, generally this is tolerable by a patient. However, we understand that this needs to be removed at night and therefore can cause problems from eating, even talking, because of the fact that there's something foreign in the mouth. As a partial denture gets bigger or it involves some of the back teeth and it becomes more functional than cosmetics, this is when partial dentures start giving problems. And generally over time with partial dentures is patients either end up having a full denture or they just live with the problems of a partial denture, which is generally movement, and it's also loss of function and speech. With this case, we were getting to the point where it was not only the partial denture causing problems, but gum disease. The teeth around the partial denture were starting to get loose. And once these teeth become loose, of course, the partial denture and the teeth move. We needed a long-term fixed solution, and this was full teeth replacement with dental implants. So the teeth were actually removed, or the infection was removed from the gum disease and dental implants replaced, and within a few days she had a new set of fixed teeth. You can see from this after photo what a great result was actually achieved. If you have any questions, please visit us at advanceddentalartistry.com.au. We're always here to help you in any way.